So we oftentimes think an otoplasty really should be for a child, but I've done otoplasties in almost every decade of life. You're seeing a young child on top, and then you have a lady on the bottom who's 70 some years old having otoplasty. For her, that took precedence over a facelift or blepharoplasty or anything else. And so we all have our priorities. I always say I don't treat heart attacks or cancer. Everything I do is elective. So you have to determine what's priority for you. So it's not unreasonable for a 70-some-year-old woman saying, look, I've always been bothered by my ears. I just never got around to doing it. And what's interesting is I actually do more adults for otoplasty or ear reduction than I do children nowadays. I think part of the reason is a lot of adults just regret not having done it, and they come back in their 20s or 30s and say, you know what, it's time for me to do this. I recently did a young lady who did a video for me, and I did her in her 20s, but I did her brother when he was much younger. And so it's interesting that this is a different way of understanding otoplasties, that it can happen for almost any age group.